right, good day from the Macomb City Hall. This is Macomb Mayor Mike Inman with the latest information regarding the COVID-19 pandemic here in Macomb and McDonough County. I understand it's been a bit of time since we last had an opportunity to get together. We're going to get you the most recent information we have, and it's from several sources, so here we go. The latest from the McDonough County Health Department, which was released late yesterday afternoon on Thursday, the 14th. They're reporting a total of 2,107, that's 2,107 confirmed cases of COVID-19 since the onset of the pandemic last year. They're currently working number of cases, 62 active cases to be exact, 1,997 recoveries, and unfortunately they're reporting 2 additional deaths since we last spoke. A male in their 40s and a male in their 80s. So our condolences go to those families impacted by the loss of those loved ones. So a total of 48 deaths reported since the onset of the pandemic. So some news today, some updates regarding vaccinations, testing, and mitigation changes that have come to light. So first of all, I think there's a great deal of interest, and understandably so, in the county's vaccination plan for COVID-19. That is still being further developed and honed by the McDonough County Health Department. So a couple of things we'd remind you of is that we are currently in 1A of that plan. That plan was adopted by the entire state. The Illinois Department of Public Health put that plan together, and it's being rolled out here locally by the Health Department. And currently we're in 1A status. That's first responders, folks in long-term care facilities, and that all those folks have not completely been taken care of yet. With the exception of the long-term care facilities, they're nearly 100% taken care of. We're still waiting for some other essential first responder type workers to be completed. The governor and the Illinois Department of Public Health has indicated that we will transition to phase 1B of the vaccination plan on Monday the 25th, so a week from this coming Monday. That plan is available through a couple of sources. We'll have that on this graphic here now. You can also check the Macomb Downtown website. You can also check the city's website, and I would also suggest you could also check the McDonough County ESDA website and the Health Department's website. At the end of the day, the Health Department is in charge of running the vaccination and immunization for COVID-19, and I would suggest that you'd look for detailed information about that as we go into next week in anticipation of that being completely rolled out and ready to go on Monday the 25th. I know there are a lot of questions. I know that there are a lot of people that are very much anticipating and wanting to be vaccinated. We're still dealing with a limited number of vaccines doses available across the board, even though we have both Pfizer and Moderna vaccines available here in McDonough County. They're still in limited number, so there is a priority basis that we're utilizing. And I think if you have an opportunity to look at that, the next phase of 1B that would go into effect on the 25th is much broader, so we'll have to have a number of vaccines doses available on hand, but that includes people who are over the age of 65. It also includes a broader group of essential workers. And again, I refer you to the graphic that's on your screen now regarding that plan, and anticipate that additional information will be coming from the Health Department, the McDonough County Health Department, as to when folks should look forward to where those clinics will be, the days and times of operation. That's all being finalized by the Health Department, and we'll very much anticipate them getting that out to us sooner than later. A couple of other things going on regarding immunizations. There's been, that I'm aware of, there's been no adverse reactions that required any kind of emergency or hospitalization or medical intervention. Several city staff have been vaccinated as following the protocol in the last 2 to 3 weeks, and many of them are looking forward to receiving their second round of vaccinations coming up in the next week or so. So we'd encourage you to be prepared, so when the plan is rolled out by the Health Department, you know what to look for, and be ready to roll up your sleeve and get the vaccine. A couple other things we want to share with you today, several to be honest. Macomb School District will go back to in-person hybrid attendance starting on Tuesday of next week, the day after Martin Luther King holiday. So those students will be back in a every other day or something like that setting, in an in-person setting. The hybrid calls for a combination of online and in-person attendance at the schools here in Macomb. I believe the other school districts, Bushnell Prairie City, West Prairie, and the folks down in the southern part of the county that are in Rushville Industry, they'll be looking to come back into some form of in-person attendance here in the next week or so as well. So that's good. Part of the next round of vaccinations includes education components, teachers, support staff in schools. So that's also an encouraging item going forward. We also remind you that community-wide testing is available this coming Sunday, the 17th, at Tanner Hall Circle and Q Lot on the campus of Western University. Again, that's community-wide. I was out earlier today and was tested along with several other city staff. There's availability in testing this Sunday, 17th, 8 a.m. to 4 p.m., Q Lot, Tanner Circle. There'll be plenty of signs out there to get you to that location. We would encourage you to avail yourself of the testing. Again, you don't have to have symptoms, don't have a doctor's order, don't have to have insurance. None of that is required. It's free and available broadly to the community. We would encourage you to test. That's part of the overall several-prong program as we get into utilizing all the prongs now: testing, vaccination, and mitigation. So things are starting to gel pretty well here, and we'd ask you to take advantage of it. You'll have another opportunity on the 23rd and the 25th of January as well. Those dates are listed at the bottom of your screen now, so we most assuredly would encourage you to get tested. The turnaround time is very quick. As I suggested the last time we talked, I got tested late one afternoon and got the results texted to me from the provider by noon the next day. It's fairly non-invasive. You're the one conducting the swabbing of your nose, so it's really something to easily complied with. Talking about mitigation, one of the prongs and the legs of the chair we're building here, the Governor J.B. Pritzker announced today that 3 regions, one of them being the region we're in, Region 1, 2, and 5, we're in Region 2, we're allowed to step back to Tier 2 mitigation. And you're saying, well, what does that involve? We're going to give you a link here to the Illinois Department of Public Health's website. It talks about what tiers are, what the metrics is to get there. That information is available at the website located at the bottom of your screen. But basically, Tier 3 was what we were in until today. Tier 2 now allows several other things to occur. Unfortunately, it does not include indoor dining yet, but I think there's some reason to be hopeful about that as we move forward. So it's talking about Tier 2. In order for a region to drop from Tier 3 to Tier 2 mitigations, there has to be a lessening of the rolling 7-day average of test positivity. We've met that criteria. There has to be a greater than 20% intensive care unit availability and hospital bed availability for 3 consecutive days. We've met that, and have a decrease in the overall hospitalizations 7 out of the last 10 days. We've met all the criteria to go back to Tier 2. Tier 2 talks about group fitness classes that can now be held. Some low-risk youth and recreational sports, in accordance with the state's all sports policy, will be allowed to resume, and cultural institutions like museums are also allowed to reopen at 25% capacity. It does also allow video gaming and casinos to reopen. However, if it's a local video gaming terminals that are inside a restaurant or a bar, those restaurants or bars are still not, at least today, allowed to provide any service of food or beverage to those folks in their gaming. However, some hope is on the horizon. And again, these are guidelines that are established by the Illinois Department of Public Health and ordered by Governor Pritzker. But Tier 1, which is much more favorable to the opening of bars and restaurants restaurants and bars that serve food, would allow to return to indoor dining. So what does it take to get there? Currently, we're meeting all the criteria for Tier 1 with one exception. We need to have 3 days of consecutive test positivity under 8%. Today, we're at 7.9%, and historically, over the last 7 to 10 days, we've been reducing our test positivity rating by about 0.3% per day. So you can do the math. If we were to follow that trend, we're currently at 7.9. Would be day one. If we can have 2 more days at 7.9 or less positivity, then we would move to Tier 1. And speaking to, along with several other mayors in the area, with the governor's staff and the governor himself this afternoon on a conference call, he indicated that even if we get to Tier 1 status over the weekend, traditionally not a day when most businesses or government is operating, we would be notified by the Department of Public Health, the IDPH, that we had met the criterion. Then those businesses would be notified by the local Department of Public Health that they now were able to revert back to Tier 1 mitigation, which would allow, on a limited basis, indoor dining and bars that serve food to open at minimum standards, limited standards. So I guess I'm telling you, I'm hopeful. I don't make the laws or enforce these orders, but I'm hopeful, and in a very candid conversation with IDPH and governor's staff today, they understood that we were trending that direction, and they assured us that once we got there, no matter whether it was Saturday, Sunday, Monday, whatever, we would be notified, and then in turn the local health department could have let those local bars and restaurants know that that had in fact happened. So we're cautiously optimistic that we're on our way there sooner than later. The other things we want to share with you is that we'll be welcoming back students for the spring semester at Western Illinois University, and speaking with the university staff and the president. They've assured us that they're going to have robust testing criteria in place for those students that are returning. They'll be allowed to test like the rest of the community this coming Sunday. They've already started testing some students that are going to be housed on campus, so we're encouraged by that. Excuse me. And again, we've got several of the legs building under this chair to move us very much in a positive direction. I would remind you that even with testing in place, even with reduced mitigation coming, and even with the vaccine being available, although very limited right now, we still want to remind you to be diligent and wear face coverings when required, utilize social distancing, and continue to utilize frequent hand washing. It's all got to work together, and I think that, for example, you can, even though the stress on some of our local businesses has been immense, I think you can plainly see that the mitigation efforts that we've been involved with since prior to November are paying off. We're getting there. You're seeing huge surges in other parts of the country, California in particular, and we're not seeing that, thank goodness. And I think that has a lot to do with everybody that's listening to this and everybody in the community who's taken these mitigation efforts seriously, adhered to them, and done their very best to mitigate the spread. Now, one other thing we want to share with you, and not as a matter of increasing anxiety, but a matter of information, that the Illinois Department of Public Health did report, as anticipated, the British variant of the COVID virus that's being discussed as being much more easily transmissible, much more contagious, not necessarily much more dangerous, but much more contagious, has been confirmed in Illinois within the last day or so. And again, that was anticipated that eventually that would show up here, according to health department experts. So again, not to add additional anxiety, but just to remind you that as this variant appears, it's now even, got to be vigilant and face masks, social distancing, and other mitigation efforts that are within our control, hand washing, for example. There's additional testing and continued testing going on in the McDonough District Hospital. The dates and times for that are appearing on your screen now. We'd also remind you that testing is available via appointment at the CVS Pharmacy here in Macomb. And again, I think in spite of some folks that are dealing with this in a very difficult way, having lost loved ones or been affected in a very serious dose, or I should say onset of the virus that's been hard for them to deal with physically and in many cases mentally. We're making progress, so I'd encourage you to stay the course. Some things are improving, and that's very obvious that they're improving by the data that is being collected at the state level. And again, if you have questions, we'd encourage, first of all, for you to reach out to the McDonough County Health Department. Their contact information is located at the bottom of the screen now. They're the driving force behind the vaccination program. And then if you've got additional information that we can help with, many of the incentive or reimbursement programs or grant programs that we've been offering here in the last several months, those monies are being distributed as we speak. I signed checks for those today, those programs that we were responsible for here at the city with our help from our state and federal partners. Also encouraged that some news at the national level that there's additional discussion on additional stimulus that would be far-reaching and substantial. So again, that's at the federal level. There's several hoops that have to be jumped through at that before that becomes law, but there is discussion obviously occurring about that. So please feel free to reach out. We'll do our best to answer questions, and until we have a chance to meet again, thank you.